My name is Tom So. I'm a pharmacist at FDB, and I'm currently the manager of the Meducation group. I received my PharmD from the University of California, San Francisco in the early 90s. I've been at FDB now for 20 years, and in my current role as a manager of the Meducation group, I direct a group of staff who are responsible for the creation and curation of the data that is in our Meducation product designed to help improve medication adherence. My approach when taking care of the work that we are involved with involves being careful and having extra attention to detail. The reason is because our product, it's consumer facing and directly given to a patient, so there isn't a learned intermediary that helps them with the information. The passion that I have for the work that I currently work on is that the work that we create is actually used by patients, in fact millions of patients. When I worked at the hospital, you had a census of maybe 200, 300 patients that you were affecting. But at First Databank, you have the ability to touch all of the healthcare continuum with your work, and thus you're affecting millions of patients. I've learned as I've gotten older, and as my parents have gotten older, I've gone to many medical appointments and procedures with them, and I'm sort of the medical advocate because I have a healthcare background. And being that advocate, helping to translate what the doctor's telling them, why they need to do what they're supposed to do, why they need to take their medication. And I think of FDB as being also that advocate for the clinicians and ultimately their patients. If you're considering working at FDB, I think the thing you have to always remember is that you can never stop learning. When I was a hospital pharmacist, we had a small formulary of drugs, and I knew those drugs inside and out. But working at FDB, we have the whole universe of drugs available in the United States and even other countries like Canada and in the Middle East. You have to know everything about all of these different drugs, so you're constantly learning about those drugs and their effects on patients. The career advice I would give to somebody considering working at FDB is that initially when I first started here 20 years ago, they were looking for clinicians that had a large amount of experience. Whereas now, I think you can consider even coming out of pharmacy school with the programs that are now available to the pharmacy students as they train to become pharmacists. You could start working. If you have a passion for the things that we have a vision and mission for, you could fit in at FDB. What I would tell my kids about choosing a career, you have to find your passion. And if you can find a career that matches your passion, then you are set for life.